Hello everyone, good evening. Welcome to the Fmge Ophthalmology 2025. कैसे हो सब लोग? So we will take a couple of seconds so that everybody can join in, and we will discuss these questions. We will also try to understand the trend. The pattern that they are taking. You must have seen in this paper that they are not asking the usual cataract and glaucoma questions. Rather, they are shifting their focus towards the other questions also. So in this paper they have hardly asked much about cataract and glaucoma, though there was a question on acute red eye. And if you remember that I told you in the class that acute red eye will always be an important scenario, and acute red eye can be acute anterior uveitis or it can be acute congestive glaucoma. So either of it can be there. Looking up what are the other clinical features they have given, you have to decide. Plus, all the questions which have been asked in this paper were mostly the PYQ questions, not of FMG, rather NEET PG. So that actually shows the importance of doing the PYTs of NEET PG examination also, INSET also, and as it is, some of the questions have come as it is repeated from the NEET PG paper, right? Okay, so let's get started, guys. Look at this question. So they have typically asked this, and if you remember, this image is from our workbook only, and this image came in NEET PG 2024 also. The same image was there in NEET PG 2024. Good evening everyone. So what are these? These are actually the Herbert pits. So Herbert follicles and Herbert pits are important feature of the trachoma. And if you remember, I told you that there has to be one question on trachoma because it is recently eliminated also in 2024. So in the upcoming NEET PG paper also, we can expect a question from trachoma, and this same image was there, see, in the NEET PG 2024. So the quiz questions that you are doing daily again will help you a lot, because somewhere, you know, one question or the other, image, concept are getting repeated. So see this is our quiz number 1478, and as it is, the question was repeated. So options slightly here and there can change, but you can see the image is same. Okay, and what are Horner-Trenta spots? Horner-Trenta spots are found in a vernal keratoconjunctivitis, which is altogether a different thing. Collections of eosinophils hai, grayish white color, itching history, ropey discharge, type 1 hypersensitivity reaction, while pannus is also found in trachoma. But this is actually the corneal ulcer. So whenever, you know, there is a lot of vascularization, inflammatory cells are coming, we have infiltration, the vessels from the conjunctiva are growing over the cornea, they are bringing the inflammatory cells along with it. So obviously we can have corneal ulcer. Whenever the corneal ulcer will heal, it will form a corneal opacity, and corneal opacity can lead to blindness. So one of the way how this trachoma can lead to blindness is this. It is the spannus and arch line. Now this is also found in trachoma, and this is actually due to the scarring. This is due to the scarring. So all these signs are usually found in trachoma apart from the Horner-Trenta spots, but the image that they have given is the Herbert pits. One request to all, if you find any modification in the image, language of the question, or any of the options now or even after the session has ended, then also you can help me modifying the questions. This is one way you can help your colleagues and juniors, so that, you know, we get the better and the right question. Okay, So this is one question. Second question is a patient with pituitary adenoma. So again, this question is also from NEET PG 2024. NEET PG 2024, and I told you that this paper will be your best mock test. Like for the upcoming NCET paper, the best mock will be NCET May 2025 paper. Similarly, NEET PG 2024 paper was the best mock for the FMG paper, and see how many questions are repeated as it is. Pituitary adenoma, even they are telling that compression is at the optic chiasma. So, you know, story is even more easy, and we are having loss of vision. So what is the visual field defect? Optic chiasma. Chiasma means crossing over, and it is the nasal fibers which cross. Because nasal fibers cross, so temporal field will be going by temporal hemianopia. So even if they have not mentioned about optic chiasma, then also you should have known that whenever there is a pituitary adenoma, craniopharyngioma, whenever there is a pituitary defect, that will compress the optic chiasma, and optic chiasma will affect the temporal fibers. The same kind of thing that we got here. Yeah, this question was also there. So one of the forms in which this question was asked, this is AIMS 2017, where they had given you the image of bitemporal. But if you look at the question of NEET PG 2024, that is missing somehow. So they had asked in the similar way, they had shown you a pituitary tumor which is compressing the optic chiasma, and we were getting bitemporal hemianopia, right? Hi Aryan, Bhuvan, Riri, Bob the Builder. Yes. So see, now another question from NEET PG PYQs, and they are telling that which kind of refractive error it is depicting. So can you see, this is Sturm's conoid. Somebody had shared the screenshot of my notes also, where I have written Sturm's conoid over this image, which is actually found in the astigmatism, and this actually came in NEET PG 2023. Will we have NEET PG expected question sessions? Yes, definitely. I am trying, but I am thinking that what day I should take, because I don't want to load you also much. But we will have a short and a crisp session for the most expected questions for NEET PG 2025. Are you comfortable doing it on 30th or 31st? Because you know, third is the paper, so I don't want to disturb you on first and second. They are totally yours, you know. So we can do a session maybe day after tomorrow. 30th is a good day I can think of. So see the similar questions, Sturm's conoid question with astigmatism. This is your NEET PG 2023. So why I am showing you again and again that how much quiz questions are important for you. We are daily doing quiz questions, even in the class we are doing them, so that you know multiple times you are doing, you have the visual memory, you will not lose them, you cannot forget them when they have been done so far, and they show the importance of your NEET PG PYQs also, right? So let's do the next one now. A patient is coming with the complaints of flashes, floaters, deep anterior chamber. So whenever you have flashes and floaters, if you remember, I told you this is always retinal detachment, and one line extra was always there in your PYQs, which they have not given this time, was a curtain like effect. So whenever you know there's a retinal detachment, it looks as if you know curtain is falling, retina is falling, as if curtain is falling in front of the eye. So whenever we have that total retinal detachment, rhegmatogenous retinal detachment, it will always give you the curtain like effect. Very, very typical of rhegmatogenous retinal detachment. And I had told you that one question will definitely come either from RD or retinoblastoma. This has been our trend. So I am happy that they have maintained the trend, and you have got a question on retinal detachment. One question, either they are giving cauliflower like growth hai, flexion of intestina rosettes, and leukocoria. Maybe they are giving the picture of leukocoria, and the other way they are asking is the retinal detachment. While when we are doing paper of NEET PG. So instead of this, then they are asking about the layers of retina, how to identify the cells, the physiology, histological identification, diabetic retinopathy, FFA findings. So there's a slight, difference in the type of questions, while the topic will remain important only, right? Is it okay now? Yes. Now see another question that I was saying that this question is from acute red eye, and again the acute red eye question was there in NEET PG 2024. In the NEET PG 2024, there was a question on acute red eye. Here we are having a female with sudden and the diminution of vision along with pain. So how many questions were there this time of ophthalmology? So hi Saransh, number of questions that students are telling is 25. However, we could not get all the recall questions. So as far as I could get, I have tried to accumulate them. But I hope that you will also help me in getting that more questions, because we have not been able to find all the 25 questions, whatever it is. So here you can see that there is a painful diminution of vision. So whenever we have sudden and painful diminution of vision, it is always acute red eye. Acute red eye, what are the two important DDs? It can be acute anterior uveitis, or it is the acute congestive glaucoma. So corneal edema and bacterial keratitis are already gone. Now you have to differentiate whether it's a uveitis or it's glaucoma. Now female is there, and above all dilated pupil. You cannot get a dilated pupil in uveitis. It is always miotic pupil. So you are sure that it is acute congestive glaucoma. Cornea, hazy cornea can be there even in cases of uveitis because of corneal edema, because of keratic precipitates. Here it is hazy because of the raised intraocular pressure, and the diagnosis will be acute congestive glaucoma. While the question that came in NEET PG 2024, there they asked about the acute red eye with the irregularly dilated pupil, where it is irregular due to the synecdoche. And synecdoche is the property of acute anterior uveitis. So whenever you look at the pupil of the uveitis, it is small, it is miotic, constricted, and when you are dilating this pupil with the atropine, then you get a irregularly dilated pupil, and this irregularly dilated pupil is actually called as the festooned pupil. It is called as the festooned pupil, and this festooned pupil is found in the acute anterior uveitis. So that time they had asked the acute red eye, but that was due to the acute anterior uveitis, and this time it is due to acute congestive glaucoma. You can also look at the age of the patient. Whenever it's a glaucoma, it will be elderly. Whenever it's uveitis, it is young. Then uveitis is male, glaucoma more commonly female, and looking at the pupil is again important. Then you can look for the Vox triad. In uveitis, you have to look for the keratic precipitate, small miotic pupil, synecdoche, iris nodules, aqueous flare, aqueous cells, hypopyon. All these things are very, very important in the cases of the uveitis. So definitely it's not difficult to differentiate between the uveitis and glaucoma when the question is on the acute red eye, right? Then the next question is a question on ulcers. So whenever we have a paper, always we get some question from cornea. There are two important questions. One is your corneal ulcers, and second is the layers of cornea. Now layers of cornea are usually asked in the inset, and NEET PG people and FMG people will ask about corneal ulcer. And see, look at the options. Even when this type of questions we were discussing in the class, I told you that mostly it is the infective ulcers, and infective ulcers they will give you all the 4 ulcers in the options: bacterial, fungal, viral, acanthamoeba, and all the 4 are having very, very different characteristics. Like here they are saying it's painless. So along with this, they are saying branching is there. So when they are saying it's a painless ulcer, it cannot be bacterial and acanthamoeba, first of all, because bacterial ulcers are very, very painful, in proportion to the size. Here in the bacterial ulcer we have pain which is in proportion to the size of ulcer. Okay, and in cases of acanthamoeba, pain is out of proportion. Pain will be out of proportion. This is the difference between the acanthamoeba ulcer and the bacterial ulcer. Now if we go with dendritic ulcer, here we have the decreased corneal sensation, so pain will not be a very important feature. That is why by the diagnosis of exclusion also it is fungal, which is usually asymptomatic. This is asymptomatic, and always remember that in fungal ulcer signs are always more than the symptoms. Signs are always more than the symptoms, and whenever a question comes on corneal ulcers, always you have to give more weightage on signs. So if you are confused between symptoms and signs, it's always better to prefer signs. Go by the signs and not by the symptoms. So branching ulcer hai, satellite lesions, maybe they are saying it's a painless ulcer with a branching ulcer. Did they use the word branching for arborizing pattern, or they use the word feathery margins or satellite lesions? Branching can be your dendritic ulcer also, because there also we have the decreased corneal sensation. So basically it depends that what language they have used, because some of the students said that we have got the satellite lesions. If we have the word satellite lesions, then it has to be fungal. Branching pattern can go with the dendritic also. It's may, yes, branching was there. So if branching was there, then we will go with the dendritic ulcer. And two questions from ulcer this time. One integrated with micro related to acanthamoeba, the other was this dendritic. Yes, Saransh, other one was the infection related to the contact lenses, and one is this. So branching, tree like arborizing pattern, dendritic ulcers you will get. Whenever you are getting the dendritic ulcers, you will get the tree like arborizing pattern, something like this. No question on satellite. So then it has to be viral only. Like this we have the knobs, and these will be the knobs actually, and this is the floor. So even there was a question in EPG 2023 where they had shown the picture of dendritic ulcer and they had asked the name of the stain and name of the filter. So floor is actually stained with the fluorescein stain, and knobs are stained with the rose bengal. This is stained with the rose bengal stain, and whenever we are using the fluorescein stain, then we have to use the cobalt blue dye. Right? Now if the knobs are present, then these are the true dendrites. And if these knobs are not there, no knobs, if you get no knobs, then these are the pseudodendrites. That is the difference between the true dendrites and the pseudodendrites. And always remember that whenever we have dendritic ulcers, you have to remember that steroids are contraindicated. We should not give steroids in such cases, because it can hasten the formation of larger ulcers, which are called as amoeboid ulcers, or they are also called as the geographical amoeboid ulcers or the geographical ulcers. Then they are called as amoeboid ulcers or the geographical ulcers, right? Okay. Then there was a question something like this. This kind of question was there in Fmge January 2025 also, where they had give the hanging drop sign or the teardrop sign. So they are telling you about the blunt trauma. Whenever they are telling you about blunt trauma, it's always the blowout fracture, which is most common in the inferior wall. So this kind of question is always coming. I told you one question from trauma. is always coming. This is also from our quiz questions 1130 hai, where 12 years old boy suffering from the cricket ball. So whenever we have ball injury, it can be a cricket ball, a tennis ball, a football, any kind of ball will always give you blunt trauma and will always give you the fracture floor of the orbit, which is called as the blowout fracture. This is called as the blowout fracture, right? Then the next question. In the next question, there was a question that they give two pictures here together, one with the chymosis, another was CT. There was a question and they give two pictures. Can you share a similar picture that came in the exam, the other picture? Can you please share, Saransh? On my Telegram group, you can share there. So I can show you at the same time. A patient is coming with a painful lid swelling. Pus point is also there at the base of the eyelashes. So you are getting the basically hordeolums. You are getting the hordeolum, and whenever you are getting acute suppurative pustular swelling, they are called as hordeolums. It can be external hordeolum or it can be an internal hordeolum. Okay, and it is the base of the eyelash, so it is external hordeolum. External hordeolum is also called as the stye. Okay, so whenever there is external hordeolum, it can be in the Zeiss gland or the Moll gland. Meibomian gland will be in the internal hordeolum. Calazions are also in the Meibomian gland. Yes, so whatever option was given in the exam from the Zeiss gland or the Moll gland, that will be the answer. I think this was there. So this is also a sebaceous gland, while Moll gland is a sweat gland. Either of the two, whichever was there, I think only one of them will be there. That will be the answer. So this was about the lid infections, guys. Whenever we have a question regarding to the lid infections, it could be acute also or it can be chronic also. Okay, whenever they are acute, go with the hordeolums, and whenever, so Moll was not there, na? That's why the answer is this. So what was the fourth option? Can you tell me what was the fourth option then? And whenever it's chronic, it has to be a calazion. Then it has to be a calazion. So hordeolum can again be external hordeolum or it can be an internal hordeolum. External hordeolum is also called as the stye, which is occurring in the gland of Zeiss or the gland of Moll, while internal hordeolum and calazion, they are occurring in the Meibomian glands. They are occurring in the Meibomian gland. So whenever you are getting acute hair, suppurative hair, painful condition hai, then it is hordeolums. You have to see whether it's a towards the lid margin, outer side it is seen, or it is away from lid margin, right? Then next question. A patient is coming with difficulty reacting to the bright light. So there's a problem with the light reflex, right? It's not, people is not able to react to the bright light, and they are saying light reflex is absent and near reflex is preserved. So this is typical of something which is called as the ARP, Argyll-Robertson pupil. So whenever we have ARP, we can remember it as accommodation reflex present. The history that these people are giving, that the near reflex is present. Near reflex is present because near reflex is based on the lateral geniculate body, and here the lesion will be in the pretectal area. So whenever there is a lesion of the pretectal nucleus, okay, cross the gland. So next was your cross gland. Thank you so much. This is there. So whenever you are getting the lesion of the pretectal nucleus, this is involved in the light reflex. Then it is called as the Argyll-Robertson pupil. It is called as Argyll-Robertson pupil, where we are getting the bilateral lesion. Bilateral lesion of the pretectal nucleus. Example is the neurosyphilis. Example is the neurosyphilis, and pretectal and Edinger Westphal are given in the same option. So this will be the answer. If they have given you combined also, then also this will be the answer. What was the other option then? Option number C क्या था? Because it is the lesion of the pretectal nucleus must be involved. Pretectal nucleus will be found in neurosyphilis. There we are getting. Please let me know about the other option. And then there is a question where girl, maybe this is the question that you were talking about, that there was one more question on the corneal ulcers. She's coming from picnic, and yes, तो नीट पीजी वाला हम लोग लेने वाले हैं. वही मैं पूछ रही थी that when should I do it, tomorrow or maybe day after tomorrow, let's see. Pain is there, and then we have a contact lens also. So basically, you know, the most common infection in the contact lens users. Most common infection in the contact lens user is Pseudomonas. So whenever they have given you Pseudomonas, you have to go with the Pseudomonas only. If the Pseudomonas is not there, then this was the first one. Then you can go with the Acanthamoeba. While these are important because they can penetrate the intact corneal epithelium. They had was a history of bath in the pond, and Pseudomonas was not in the option. So if this was not in the option, then your next will be the Acanthamoeba. And if they have given you history of bath in the pond, so we can think about the soil infected infection. So it is the Acanthamoeba, which is a common amoeba present in soil, from which also we can have infection. And the most important risk factor in the Acanthamoeba keratitis is the use of contact lenses. So that way your answer is Acanthamoeba. But if Pseudomonas was there, Pseudomonas will be the answer. Pseudomonas not there, then next is you can go with the Acanthamoeba. Then the falling light reflex is seen in the patient, and they are asking the deviation. So I think they are giving you the deviation at the limbus, right? So first of all, you should know what is the name of this test. This is called as the Hirschberg. This is called as Hirschberg corneal reflex. And I read 4 times to read. Yes, that is very good, because if Pseudomonas was there, then you have to mark Pseudomonas only, right? Corneal reflex test. Very good. Hirschberg corneal reflex test hai. So if it is in the center, then it will be 0 degree. If it is at the pupillary border, it will be 15 degree. At the limbus, like they have shown, it is 45 degree. Okay. And degrees ko, if you are converting, is 1 degree is equal to 2 prism diopter. So here the answer will be limbus. Limbus is 45 degree, or it can be 45 into 2, that is 90 prism diopter. This is how you have to do this question. Okay. So one thing is that here, instead of focusing towards cataract and glaucoma, they have focused towards neuroophtha, they have focused towards corneal ulcers, day-to-day questions, nerve palsy, squint. So, you know, newer and newer topics as exploring. Then another question that we always do in squint, down and out. And I told you also that don't try to derive it. Just remember that if it is down and out, then it is always third nerve palsy. Now suppose you do not remember the down and out, then even ptosis is also given. So then also it is third nerve palsy, because it is all 3, SO4 and LR6. Yes, ma'am, they mentioned in the question about Hirschberg test, and they asked about the PD. Okay. So, except for these muscles, all the muscles are paralyzed. and therefore LPS palsy is also there, and LPS palsy will lead to ptosis, and only those muscles are able to act which are supplied by the other nerves. So now superior oblique can work as well as lateral rectus can work. Okay, now what are the actions of superior oblique? Superior oblique hai, therefore it will do rotatory, and we know that superiors are intorters, right? So intorsion, O for oblique and O for opposite, therefore it will go into depression, and recti are adductors, so obliques are abductors. These are the actions, while lateral rectus will also do abduction. So depression and abduction, therefore the eye will be down, depression and out. This is how the eye will be down and out. So whenever there is a third nerve palsy, always remember that you will get eye down and out. You will get ptosis, and also third nerve is the efferent nerve. It's a efferent nerve for the pupillary reflexes. So you will have the dilated pupil. Therefore we will get the dilated pupil. Does that change the answer? They have also given ptosis. One of the option was ptosis. So even if ptosis is there, then also your answer won't change. Answer will not be ptosis. Ptosis, so they have already given you. Down and out will always mean equal to third nerve palsy. That will not change your question. Okay. Then they are asking about the posterior staphyloma. So posterior staphyloma means we are getting the ectasia in the posterior aspect of the eyeball. If this is the eyeball, we are getting the posterior ectasia. This you are getting in cases of the high myopia, because it's a degenerative condition. So this also we have done so many times in the classes. High myopia, the picture is also there of the tessellated fundus. So it is also called as pathological myopia, degenerative myopia, high myopia, where you have more than -6 diopters, right? Options, I do not know what are the other options, but answer is definitely high myopia. And even this kind of a question was there in the inside examination also. They had asked what is the complication of diabetic retinopathy, and posterior staphyloma was also there in the option, though answer was the tractional RD, but there was a posterior staphyloma also. So basically what I'm trying to say, that whenever you are doing the PYQs now, look at the options also. Sometimes they are picking the option and they are forming the another question on it. So even all the topics which are there in the options, they are also important. There was no option of high myopia. In this question, they give us about the posterior curvature, and in the posterior and in the options posterior staphyloma was there. They had gave us about the posterior curvature. Okay, so if they had said about the posterior curvature, then and they have not given high myopia, then your answer will be posterior staphyloma. If they have given the posterior curvature. So some people are saying कि posterior staphyloma was there. Some people are saying it's high myopia. So posterior staphyloma and high myopia, whatever was there. Then they are saying coloboma was there. One of the options was coloboma. One is coloboma, one is staphyloma. What were the other options, guys? Please let me know. Then there was some question on shield ulcers. I do not know. Shield ulcers are found in the vernal keratoconjunctivitis. These are found in the vernal keratoconjunctivitis, which is actually the most common allergic conjunctivitis. And you will get intense itching and very typical ropey discharge, intense itching, ropey discharge, all these things will be there. Vernal keratoconjunctivitis mein detachment was there, coloboma was there, and posterior staphyloma. What about these? What was the fourth option, if you can remember that also? Please try to recall the question on shield ulcers. Then there was some question on junctional scotoma. There was some question on this. I didn't see any shield ulcer. There was a question in which they said about decreased corneal sensitivity. Okay, decreased corneal sensitivity. If there was a decreased corneal sensitivity, then if it was a question on ulcers, then it has to be viral keratitis, and then it could be leprosy also. But if they had asked about the ocular problem, then it would be viral keratitis. Then there was a question in which they had given about aphakia, pseudophakia. um, then some people said that there was a question on junctional scotoma. Please, if you can remember any other question, because I know that questions are much more than these ones. We could not recall all the questions, and they were telling just one or two words, and we do not know the exact language of that question. So if you could recall more of the questions, more of the images or the options, then you people are welcome. पोस्टीरियर स्टेफाइलोमा ऑप्शन में था, तो डेफिनेटली आंसर पोस्टीरियर स्टेफाइलोमा ही होगा. और अगर यहाँ पर डिक्रीज कॉर्नियल सेंसेशंस में हर्पीज है, देन डेफिनेटली वायरल कैरेटाइटिस हर्पीज आंसर होगा. सो all the questions that we could recall, these are the questions and the answers. What I would say that what is gone, and I hope the paper went well, because ऑफ्था के तो क्वेश्चन सारे नोट से ही थे, ट्विस्टेड भी नहीं थे. व्हाट वन थिंग आई गॉट फ्रॉम मेनी पीपल की ऑफ्थेल्मोलॉजी क्वेश्चंस ट्विस्टेड थे, गायनी क्वेश्चंस ट्विस्टेड थे. तो आई डू नॉट नो अबाउट द अदर सब्जेक्ट, बट ऑफ्था के क्वेश्चंस बिल्कुल भी ट्विस्टेड नहीं है. डायरेक्ट क्वेश्चंस है. हार्पेटिक पिट्स वी हैव डन, ब्लो आउट फ्रैक्चर है, या फोटोप्सिया एंड फ्लोटर्स इन रेटिनल डिटैचमेंट है. उससे ज़्यादा डायरेक्ट क्या आ सकता है ना. पोस्टीरियर कर्वेचर शो करके पोस्टीरियर स्टेफाइलोमा पूछ रहे हैं. बट हाँ, डेफिनेटली अगर आप सिर्फ रट के गए हो, वन लाइनर्स करके गए हो, जस्ट ये मगिंग अप, ये वाली लाइन्स याद कर लो एंड यही आने वाला है, तो वो नहीं होगा, है ना. अब वो वाले दिन तो बहुत दिनों पहले ही चले गए. हाँ, लेकिन अगर हमने कॉन्सेप्ट से पढ़ा है, हमने समझ के याद किया है, एंड वी हैव रिवाइज द PYQs एंड PYTs, तो आई डोंट थिंक कि वो वाली प्रॉब्लम आने वाली है. दे गिव अबाउट ए फेकिया क्वेश्चन दैट वाज अ बट इन एग्जामिनेशन नो लेंस इज सीन. ओके, तो ये वाला क्वेश्चन तो हमने क्लास में भी किया है ना. इफ यू रिमेम्बर द सेम क्वेश्चन, जिसमें कि पेशेंट वाज हैविंग दी, या उसमें क्या था कि इफ देर इज अ डिमिनिशन ऑफ विजन, ये क्वेश्चन मैं बताती हूँ. दिस इज अगेन TND क्वेश्चन जो हमने किया था. देर इज अ डिमिनिशन ऑफ विजन फॉर नियर and far. So first of all, whenever we have a diminution of vision for both near and far, then it is always hypermetropia. ठीक है. अब they are saying that there is no lens. No lens means there is a decreased power. Decreased power is all again hypermetropia. Again, then they were saying limbal scar होगा. Patient 60 years का होगा, who has gone for the cataract surgery, and therefore there is no lens. No lens means decreased power. Decreased power hypermetropia, which is corrected. It will be correctable by +11 diopter. So +11 diopter से क्योंकि ये correct हो रहा है, therefore it has to be aphakia, not pseudophakia. One is aphakia, pseudophakia नहीं है, because if it is pseudophakia, we have already given the IOL, then it will not be correctable by +11. Then एक option था उसमें hypermetropia. Hypermetropia है, but this hypermetropia is due to aphakia, and one was the posterior dislocation of the lens. This was our TND question जो अभी हमने recently किया है. So answer will be aphakia. Please see. Any other question, guys, that you can recall? Any other question that you can recall, guys? All right. Oh, सो नो प्रॉब्लम. देखो स्यूडो फेकिया और ए फेकिया में सबसे बड़ा डिफरेंस क्या है कि दे आर सेइंग दैट इट इज करेक्टेबल बाय +11. इफ यू हैव ऑलरेडी गिवन द आई वेल देन इट विल नॉट रिक्वायर +11. तो प्लस दे आर सेइंग कि नो लेंस इज सीन. लेंस नहीं है. इवन दे हैड इवन से दैट देयर विल बी डीपर एंटीरियर चेंबर because the thickness of the lens 3.5 to 5 mm has gone to the anterior chamber. लेंस नहीं है तो डीपर एंटीरियर चेंबर भी होगा. तो आंसर विल बी ए फेकिया एंड नॉट स्यूडो फेकिया. So these were all the possible questions. ऑप्टिक काइज्मा वाला था. एनाटमी का ओवरलैप. बाइटेम्पोरल हेमियोनोपिया ओवरलैप तो उसमें कुछ है ही नहीं. पिट्यूटरी एडिनोमा डायरेक्टली ऑफ द क्वेश्चन है. Bitemporal hemianopia. So this was all the questions that we could recover in FMG July 2025. Thank you so much guys, and stay tuned for the most expected questions of ophthalmology for NEET PG 2025. See you guys. Thank you, and please let me know if you want to change or modify the language of any question, any of the options or any of the images. Thank you. Goodbye guys.